got a bill in the mail from Robbie's seizure doctor, and it's for a missed appointment. Now, this is from last month when Robbie was at the old group home, the one that I said was completely unorganized, unstructured, and everything they do is very sloppy. So what happened was, the guy that usually is in charge of watching Robbie called out sick. So nobody took him to his appointment, and he missed the appointment. Now, I try to go to doctor's appointments as much as I can. If I feel that they're going to, change his meds or something, I try to stay on top of it. That's really unusual. Most of the people that are in group homes don't have parents or anybody that's really involved. The group homes are the ones that are in charge of all doctor's appointments and everything, and all of their daily, daily life activities. So they were a little surprised that I actually came to the doctor's appointments. Now, Robbie had not had a seizure in over a year. I knew that the doctor was not going to change his meds, so this was just basically a follow-up. So I didn't plan to go. And because I didn't go, Robbie didn't go. Now, what I feel is that the AD, who is the assistant director, which is the person that runs the actual group home, should be the one that's in charge of all the appointments and everywhere that each individual person in the home, they should be in charge of getting them where they need to be. That's not how this group home is run. They leave it up to individuals. And Robbie has about 6 different people that are in and out of the house all day taking care of him, and no one is staying on top of everything, and that's why it's so sloppy. That's why I can't find his clothes. He doesn't get to the appointments he needs to go to. There's no calendar being kept. It's just chaos, basically. So in the new home, it's run, in my opinion, it's run the right way. There's an AD that is in charge of everything, and it's the AD's job to get Robbie to the doctor's appointments. And the AD actually goes to the appointments, not the staff members. If the staff member goes, it's because the AD has scheduled it and told that person to take the member to their doctor's appointment. So that's the way it should be run. So as far as the bill goes, the doctor's bill, I personally feel I shouldn't have to pay for their incompetence. I feel that organization should have to pay this bill. It's only $30, but it's just the point. And now I'm going to have to somehow try to figure out who's in charge of the money, and who's going to pay this bill. I have no idea. I don't know. I don't even know where to start. Because Robbie doesn't live there anymore. I may call the doctor's office and tell them to call the main office over there and talk to them and have them pay for the bill. While I'm on the subject of doctors and insurance, one of the reasons why I show Robbie wearing pull-up diapers and the amount of care that he needs is because Medicaid pays for diapers. However, they pay for not pull-ups, but diapers. The kind that, that you put on a baby, that they have to lay down and you wrap it around them and you put the little tabs on the sides. Now, how is Robbie supposed to go to the bathroom independently if he's wearing those kind of diapers? It's ludicrous. It's silly. And as far as insurance companies are concerned, Robbie's just a name and a number on a file in a computer. What do they know? So that's why I try to show these things so that people really understand. I don't know who's ever really going to see it, but I'm trying to make a point. Well, it's Tuesday, and gosh, it's just so much warmer than yesterday. It's 25 degrees today. So I'm sitting here warming up my car, and if my camera's shaking, it's because I'm shivering in the cold. Today's big activity is going to doctor's visits. Robbie is going to the seizure center today, which is located inside the hospital. And this is just a follow-up to check up on his meds. So far, we're doing really well. It looks like we have a good dose. And then this evening, he's going to see a psychiatrist, which he's never seen before. The psychiatrist, I think, is supposed to prescribe the Risperdal. So I have no idea how a psychiatrist works with somebody completely nonverbal. I'm assuming that they're going to ask me questions and they'll go based on whatever I have to say. So who knows? I don't know. So here we go. So here's what our experience has been going to doctor's visits. As I'm sure you probably can guess, we've seen many different types of specialists. Robbie also has Charcot-Marie tooth syndrome, and that affects his hands and his feet. And anyway, we've seen a bunch of different specialists, and Robbie doesn't wait. Robbie is really, really, really impatient, and you have to do things immediately, or he would throw himself on the floor, or throw a tantrum, or throw something across the room. And over the years, we've gotten better and better and better at waiting. And that's one of the things that they worked with him on at his school, was waiting. As many people can probably guess, some doctors' offices, you have to wait a really long time for that doctor. So what I started doing was, in order to really more for the doctor's benefit, because I didn't want Robbie to destroy their office or cause a scene in front of other people waiting in the room, I would call and try to explain to them when we make our appointment what the deal is. And one time we went to go see a specialist, and I specifically told them he has autism, he's not going to wait 45 minutes. So please, let me know, when we can come. And they told me that I wouldn't have a long wait. Come on in. And sure enough, we sat there for 45 minutes. Robbie wouldn't sit in the chair anymore. He was on the other side of the room, sitting on the floor, throwing things and, putting on a good show for the people in the waiting room. The doctors that are really good about this are the ones that are used to special needs patients. They will make sure that there is not a long wait. One of the best ones was Robbie's dentist. We had a dentist that he was a pediatric dentist and did special needs patients. So I had a minivan at the time that had a TV in it with a VCR, and I had that for Robbie so that when we would go places, he would have his movies to watch. So what they did was they would schedule Robbie as the last appointment of the day, and I would sit and wait in the car with Robbie while he would watch movies. And then they would, did I have a cell phone back then? I don't even remember. Somehow they let me know. They called me and said, okay, you can come up now. So it would be after all the other patients were gone. Then we would come into the office, and they would take us right in, and Robbie would go straight in to see the dentist. So that was great. So you have, in everything, you got good people and bad people. You got people that get it and people that just don't. So in my experience, I've had, when Robbie needed his wisdom teeth, I had an oral surgeon that just flat out said, I won't see him. I don't take patients with special needs. So in my experience, I've found that, I try to find the doctors that deal with kids with special needs, because they're much more sympathetic, and you just get better treatment at the office, and they're more patient and more understanding all around. And he doesn't even really mind getting a shot. So it's kind of shocking. So he doesn't mind the doctor. He doesn't like waiting. So what I do is I bring snacks for him so that when we're sitting in the waiting room now, I just keep handing him a little treat here and there just to keep reinforcing the good behavior. That's a technique that I learned from his school from when he first started, when he was 3 years old. But when it comes to sitting in a doctor's office and something where there's no TV and he's bored and there's nothing for him to do except just sit there and wait. There's no music, there's no nothing for him, and he doesn't know why he has to sit there. Those are the times where I have to reinforce the good behavior, the good sitting, good waiting, and he's looking for that treat. And if he doesn't get the treat, the behavior that he's decided that he does is he will wet himself. He will pee through his diaper. He will soak all the way through it, soak his pants, when we're sitting in a chair in the doctor's office. So you can imagine what that scene is like when we're sitting there with a bunch of people in the office and I discover that he wet his pants and we have to get up and the chair is wet. So, usually I'll look for that leather chair, not the cloth one, if we've got it. And we have to get up and go into the bathroom, and I have to bring a whole change of clothes for him, and we have to go in and change everything. In a public bathroom, we've got to change his clothes, take his shoes off and everything. One time, he even had diarrhea. Yeah, that was a lot of fun, trying to clean that up in a public bathroom with no shower to stick him in. Any mom that has a baby or a toddler that has ever dealt with the diarrhea, imagine that on a 22-year-old. Exact same scenario, just a whole lot bigger. So, this is my life. This is my life, and this is my normal. So, since we've got 2 doctor's appointments today, I'm making sure that I bring some candy and some treats so that we can avoid, our little diaper accidents today. Here we go. I've got to find my baby yet. I need you to soothe my head, turn my blue heart to red. Doctor, give me the news. I got a bad case of loving you. No pills gonna cure my ill. I got a bad case of loving you. A pretty face don't make no pretty heart. I learned that, but it's from the start. You think I'm cute, a little bit shy. Mama, I ain't that kind of guy. Doctor, give me the news. I got a bad case of loving you. No pills gonna... Okay, so we just got out of the psychiatrist's office, and basically he just asked me about, his aggressive behaviors, what medications he's been on, etc. So believe it or not, it's 8 p.m. Then we're just getting out of this doctor's office. So I'm gonna call it a night.